Department of Manitoba General Hospital. Nervously sitting in the waiting room, he felt out of place, as he did not usually visit hospitals. He typically managed his health issues, such as sickness or pain, with indigenous herbal remedies at home because he did not have easy access to health care nearby. Fourth-year nursing student Ryan was assigned to work with nurse Allison, and together they walked into Achak's room to assess him. Allison introduced Ryan to Achak and then shared the doctor's report, noting that Achak had fainted due to dehydration and low blood sugar levels and had been relying on home remedies for pain. Allison asked, "I was wondering if we could go over the home remedies you've been using for your pain." Achak replied, "I'd be happy to share the home remedies I use." He explained, "I've been using willow bark in my tea and smudging as part of my healing for pain." Allison made a note of the assessment and quickly moved on to the next patient. Ryan observed everything closely and realized that Achak wasn't receiving the thorough assessment he needed. He noted that Allison seemed to be addressing only the physical aspect of Achak's condition, neglecting a more holistic approach.
A few hours later, Ryan reflected on what he had learned in school, particularly the principles of story theory, such as intentional dialogue, connecting with self, and creating ease. Ryan saw this as an opportunity to apply the concepts from his theory course into practice, by actively listening and asking open-ended questions to better understand Achak.
Ryan gently asked, "Where did you come from today? You look tired." Achak shared that he had a long 2-hour commute, which made him feel even more exhausted upon arriving at the hospital. Observing Achak's nervousness about being in the hospital, Ryan asked, "If possible, can you tell me what's making you feel nervous?" Achak hesitated before answering, "I don't know. I don't usually come to the hospital." Ryan gently asked, "Can you share why?" Achak replied, "There are many reasons. I'm not sure where to begin. The main issue is the 2-hour travel from my home. Also, 1 year ago, my daughter suffered because she didn't get proper treatment. The care she received didn't align with our traditional practices and culture." Ryan listened intently, expressing empathy. "I'm really sorry that happened to you. How is your daughter doing now?" Achak responded, "She's doing much better now, thank you for asking."
Through his thoughtful approach, Ryan realized that he had applied all the key elements of story theory, building a genuine connection and creating an environment of trust and ease.
Later, Ryan reported his findings to nurse Allison, who reflected on her approach and realized her mistake. She looked at Ryan and said, "I'm sorry if I seemed rushed earlier. I realize I haven't given you enough space to discuss what's important to Achak."
Ryan then recognized that he had also addressed the orientation phase of Peplau's theory. In this phase, the nurse understands the patient's problems and collaboratively determines their need for help. Ryan had done just that by connecting with Achak and understanding his concerns.
Achak called Ryan for assistance with his traditional smudging practice. Achak asked, "Is there a room where I can do smudging? It's a traditional practice I do by burning herbs like samari bachi." Ryan responded, "Of course, I'll help you with that. Let me talk to my nurse and the hospital management team to find a space for your practice." A few minutes later, Ryan found a room for Achak to practice smudging. Ryan made sure to integrate Achak's traditional remedies with the prescribed medication. He simplified the medication instructions, ensuring Achak understood when and how to take it, and reassured him that continuing his willow bark ore and smudging practices would be safe. Ryan noticed that Achak was starting to trust him, using him as a resource to find help, which indicated that he was moving into the working phase of Peplau's theory. Later, Ryan brought the care plan to Achak's room. He said, "Hello Achak, here's the pain medication prescribed by the healthcare provider. You can still continue your smudging and willow bark treatment. I've also looked into local resources that might help provide spiritual and physical support closer to your home." Achak smiled and replied, "Thank you so much for considering my traditional beliefs. I'm looking forward to adopting the new medication and diet plan and moving forward with my care." This shows resolution phase of Peplau theory, where the patient begins to adopt new goals and moves from dependence to independence.
Ryan realized that he had also applied Leininger's Transcultural theory, which emphasizes the importance of cultural competence in nursing. By respecting Achak's cultural practices and beliefs, Ryan had provided effective and empathetic care. A few hours later, Achak's pain improved, and the doctor explained his treatment plan. Achak was cleared for discharge. Achak left the hospital happy and confident in his care, returning home to his family.